Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle. Welcome to Reimagine Your Lifestyle. Today we have an amazing doctor with us, and I've already enjoyed conversations with him. I had to actually stop him so we get it on camera, but it's a pleasure to have you, Dr. Nozer. Thank you so much for making time. I know how busy you are. We have so many patients who come to you. I know you run your clinics. And thank you for making time. I like what you said before we were talking. You and I, we enjoy our profession with our patients, but we make time for things over and above that because a message can reach millions of people today with social media and everything done. The right message, and then there's also the wrong message.
True.
And that's why we have experts like you on our show today to help people think differently. We live in a world today where people are sold instant gratification, quick fixes, can't get pregnant, here are 5 easy ways to do it without being told what the consequences could be. And some of these are great for people who really need it. And for some of them, they live a lifetime of suffering with the side effects because they haven't been introduced or coached into the process the right way. But thank you for making time. Doctor, I would love to start off with you taking us through your journey. Why did you get into this particular field of medicine? There were so many other fields you could have gotten into it. And from then till now, your success, your publications that you've written, and of course, a book which you've actually released. I've read Sonali's work, her previous publications, fantastic stuff, great knowledge, great experience.
Yes.
So I was really happy to see a collaboration between the two of you bringing lifestyle, nutrition, and medicine together. So, over to you, Doctor.
Thank you, Luke. Thank you. So for me, this is really meaningful because I too have patients of mine who are also with you. And I believe this collaboration between medicine, nutrition, lifestyle is all important. In fact, it's one of the cornerstones of my practice. I have 2 full-time dietitians with me, and there's not a patient of ours who gets away without having to go with them, not one. So I once wrote an article which said I have the best job in the world. I mean, I've nothing against other jobs, but truly I have the best job in the world. And growing up, parents were always the inspiration. Father was a professor. Mother was a doctor, full-time, BARC, and she was wonderful. And she taught me about how important care of patients is. But my specialty found me when in my medical school posting, the first time I saw a baby being born, I said, this is what I want to do for the rest of my life. And then, of course, there's so much more to gynecology and obstetrics because gynecology is really 360-degree care of women. I sometimes joke with my patients that I'm so happy I look after women, you know. Women are so much more interesting than men. And we have everything from looking after adolescents, looking after normal and problems during adolescence, looking after women in their reproductive lives, both from the point of view conception, difficulty in conception, the pregnancy, when not to be pregnant, and then finally going on to the midlife. Prevention. Prevention is a big part of what we do or what we should be doing. So this is where we are at, and love spending time with patients. It energizes you. You know that. You said you just love the consulting because for us, the energy comes from what we do. The book you mentioned actually came pretty late. I have lots of medical publications, almost 16 of them when you're talking to doctors and sharing knowledge. But so you mentioned Shonali, who long-term patient, became a very dear friend, as lots of patients do. Comes at the end of my clinic one day. She always tells this story beautifully. She takes an appointment and tells my staff, give me the last appointment of the day. And she comes and springs this on me and said, can we do a book together? And I said, yes. I always joke it's a moment of weakness, and she may have regretted it 4 years to write the book. And I'm so glad we did it because when we did a kind of a scan, we found that in India, we really don't have anything for women related to menopause. There are books internationally, but they are very one-dimensional. Someone saying, everything has to be non-medical, and the other side saying everything has to be hormone replacement. So we thought it has to be holistic. That's what life is. It has to look at both sides. Every woman does it differently. Every woman does it uniquely. And we have to give women these tools. I suppose that's what you do with your work and your podcasts. Once you give people information and once you empower people with knowledge, not only will they make the right choices, they will also seek out avenues in which these choices will be fulfilled. And I think that's a big part of what all of us who look after the healthcare and other care of people and human beings should do. So I love my work. I don't really count the hours I work, because when someone asks me, how do you do it? I say, who's working?
Yeah, you love what you do. Yeah. No, thanks for explaining that, doctor. And I love how you and Sonali actually had a look at what's happening on the other side, because I completely agree with you. I think a lot of the breakdown in healthcare today, I'm not just talking about allopathy, in all forms of health, even some parts of alternative medicine, they kind of put people in a box.
That's
that it
right.
can only be this way, it can't be that way. There are certain cultures today preaching to other cultures that this is how long you should co-sleep, this is when you should have sex, this is when you should do IVF, without understanding that there are so many other dimensions involved. And then people try to conform to a system,
So
and
true.
and the problems are growing, they're not getting better.
Correct.
With all the information, there's so much of information today about menopause, perimenopause, pregnancy, but we have more problems because I think people have put themselves into that box.
Yes.
And that's why I love the name of your books, 360-degree
Yes.
approach. And I think that kind of makes sense. But you started with the word menopause, so I think let's start straight from there. It's not uncommon for me to have a patient who comes in today and says, Luke, I think I've manifested my horrible menopause. And my first question is like, why do you call it horrible? Isn't it a natural process? I mean, I was speaking to a Japanese doctor, and she told me that in our culture, menopause is a gift that comes to women because it's moving them psychologically and spiritually, and of course hormonally, to a new dimension of their life. And then she added that we don't care about what people think anymore.
Correct.
It's like you get that power. And she said,
That's
but
right.
the whole world is
That's
resisting it, fighting it. And I mean, we all know, like, what we keep saying we don't want always comes back to us.
True.
And then when I started moving out into society and seeing most women who are 35, 38 are talking about menopause like it's a disease. I hope I don't get hot flushes. Oh no, I'll never be able to have sex again. Oh no, this is going to happen. And they just speak the negatives about it. And I asked them one question: if menopause was that bad, do all women go through it?
Okay.
And the answer is no. All don't go through bad menopause. Everyone goes through it.
Correct.
So then what's the difference between these two categories of people? I would love for you to talk from your experience.
Yeah.
How should we look at menopause? How should we prepare for it? Of course, we know there's great science and medicine today that can make it better when there are complications. And then there's, of course, the whole attitude, lifestyle, the way we're living today that can also contribute towards a healthy menopause.
True. So again, when we decided to collaborate, and it started with menopause, and we said menopause itself boxes you up into a very small space. And menopause is an event. For people to understand, it's something that's used very casually. Menopause is an event. It's the last menstrual period in a woman's life, followed by 12 months of no periods, and then we say you're menopausal. Traditionally, we called it climacteric, this whole process, but we kind of accepted the term perimenopause. And I think for women, it's much better to look at their whole journey as a perimenopause, the time before, during, and after menopause, which spans about 8 years, about 6 years before and 2 to 4 years after, when changes are happening. You're right, everyone does it differently, everyone does it individually. I hear all the time women saying, but our mothers and grandmothers did it so well. I would kind of say yes and no. Sometimes I feel because they didn't know better. Sometimes women have been conditioned to accept quietly and be told that this is what happens. So this is something that is increasingly being spoken about now, maybe not enough. And even today, when we do interact with women, we find a lot of women are still not exactly clear about what's going to happen. This is something that will happen to all women. 50% of the world's population is going to change. We now call it the midlife because she's going to spend maybe 40% and in future even half a life after.
Yeah.
Many of them will just sail through most of it with minor discomfort, but many of them won't. The varied estimates, India, overseas, which says that about 50 or 60% will have significant symptoms, not all of which require treatment. And about 10 to 15% they can be quite significant, and in 5% they will be distressing. This disrupts your life. This also comes at a time in your life like that Japanese woman shared with you, when a lot of change happens also because of where you are. So there are the hormones, but there is also your time in life, your place in life, your achievements in life, what's happening to your immediate surroundings, your family, which impacts you. And I think the important thing is to recognize it for yourself, understand and learn what implications there are going to be. Many of them will just be explained and it'll be okay. That's it.
Yeah.
And some of them definitely need help. And the help for me will always start off with lifestyle. Always start off with her looking after her health and nutrition, with a backup of medical care as and when required. And you did rightly mention there are advances very often misunderstood, unfortunately very often demonized, which are really there to benefit women when they require it. What about this woman in her 30s who's talking about it? Well, basically, maybe there we need to tell women and men, but more so women. You know, German Greer once said something quite interesting. She said, women are so interesting, their lives go on changing. Men, poor, boring things, go on in their same groove all their lives. Women have dramatic shifts in hormones. And when these dramatic shifts happen, if they are prepared for them, they do it better. So maybe when she is in her 30s, she needs to prepare for her 40s, because her 30s define her 40s and her 40s define her 50s.
Yeah.
That's what I learned from my co-author. And without fear, with more understanding. I think sometimes fear comes from ignorance, not knowing and not understanding enough. And you're so right. Today, the information overload that people have sometimes only ends up confusing them more. But if you have clarity which says, you know, there's going to be a change in your lives, you are going to change hormonally and other ways. These are things you can do to prepare for it. This is how you can make your bones better, your heart better. This is how you can make sure that you handle your weight by preparing for it earlier on. And then as and when time comes, don't be afraid of it. There's enough to take care of you. Don't be ashamed of it. Women are actually ashamed to talk about the fact that they are menopausal. They are embarrassed when they are sitting in a room full of people and having a hot flush and they're trying to hide it. And they don't need to do that. They're embarrassed by the emotional changes they're going through at that time, and they don't need to. So I personally feel that it's time that it started coming out. We start speaking about it, that women prepare themselves and seek out help from dependable people, sources, to make sure that they get the best possible care. And I'm not talking about healthcare. I'm talking about quality of life. Healthcare has to be about quality. It just can't be about a medical fix where you come in, get a prescription, and out you go. It has to be the whole package.
I love that you say that, doctor, because you know a lot of people think that way, and maybe it's the system or the perception of the system, or the fact that people can Google. They come in and they say, hey, you know, I have estrogen dominance. What's the meds that I need? Who should I see and stuff? And we're like, why do you first have this problem?
So I have a cup on my table, which is always there and always full of coffee. I just told Luke before the podcast that you know, I suppose everyone's allowed to have one such poison, and so for me it's coffee. And the cup has something quite interesting written on it. It says, please don't confuse your Google search with my medical degree. So I have no problem with Google. I think it's time that people became more involved. There was a time when people were dictated to by the system. This is what you do because I told you to. And I'm very happy for people to come and kind of share with you. But at the end of it, they have to understand there's a line between what information they glean and then working with someone who will put it in perspective.
Mhm.
So there's got to be this kind of partnership.
Yeah.
I would also try and hope that people found sources.
Mhm.
I would hope people would find difficult the proper guides through this difficult situation. Okay. The information you put out on your podcast, the information that certain professional organizations do as a social responsibility, where you would expect to get a lot more reliable, balanced information than something that's out there so that it gets the maximum possible
Yeah.
viewership.
Absolutely.
And once
Yeah.
people understand that, they do so much better. My patients are encouraged to come with a list of questions. So by the end of it, we have clarity on almost everything, which we kind of arrive at together. And the other thing that you did mention earlier was about all these different things available. And there I believe that I am not allowed to have an ego. I have my specialty. I have to educate myself about other issues. Medical school didn't really teach me about nutrition and lifestyle.
Mhm.
And that's really so sad because medicine just teaches you about medicine. And so, as a provider, I have a responsibility to, and if I don't, I still have to have an open mind to allow my patients to explore avenues which are safe but good for them. And I'll say, God bless you. At the end of it, I want you to be well. I don't understand alternative medicine because I'm not trained in it, but I do appreciate the fact that there's a lot of things that alternative medicine can help you with.
Mhm.
And we have it has to be the whole, everything has to be there. At the end of it, it's only she that's in the center of the equation and nothing else. And each person is so different. Each
Unique,
person
yeah.
is so unique. Each person has their emotional, their physical, their mental, their medical needs. And the trick is, and honestly, it keeps my life so much more interesting. Imagine if I sat there and said the same thing to everyone every day. And here, every patient is like an enigma that.
Mhm. No, I agree with you, doctor. And I love the fact because a lot of your patients come to us and says, he also told us to sleep better. So I said, so were you waiting for like two people to tell you to sleep better? What about common sense and stuff? No, but I love the fact that you emphasize lifestyle because a lot of women, and not only women, even men who have hormonal issues today, it's not, we have males with breast cancer as we speak today. We have males with estrogen dominance, low testosterone, going through their midlife crisis, which we call their male menopause for them.
Yeah.
But the fact is, a lot of them think that they're a victim of their genes and hormones. Oh, my mom had it. And we're like, no, your hormonal balance is what you create based on your food habits, your sleep, your stress levels, the kind of exercise. Some women overtrain when they're not supposed to at that phase. There's a place and time for everything.
So true.
Some women, we see a lot of women on their cycles, exercise suits them, but it doesn't suit everyone.
So
Some
true.
of them need to take that break, but then you have like we discussed certain cultures which are very extreme. No, it worked for me, so all women should work out during their period cycle. Whereas our culture originally talks about listen to your body. Maybe there are a few asanas that can relax you, kind of help you through that difficult phase of your period cycle. And there are some who can lift weights and even run.
True.
But I love what you say about uniqueness and bio-individuality because
Yeah.
that's what keeps our job interesting.
I
Because I would be
know.
bored by now telling everyone sleep, this is the food you should eat. So
Yes.
it kind of makes it interesting.
Yes.
Doctor, over the last couple of years, you've seen menopause kind of change with women. What are some of the tips that you would give our audience? I love what you said because I'm a huge fan of saying that how we're going to be in our 70s is what we do today. The next 5 years, in fact, the next 1 week is dependent on what we do
So
today.
true.
So what are some of the tips that you would give our
So
audience out there to prepare for a beautiful menopause, perimenopause, and even if they're going through menopause now, what are some immediate things that they can start looking for over and above complication?
Yeah. So it's I mean, you prepare for everything in life. You prepare for your next holiday, you prepare for what you're going to do tomorrow. How can you not prepare for something that's this important and this inevitable in every woman's life. And we know that human beings are hormonal creatures, but women more so, because women's bodies are constantly being exposed to tremendous changes and variations in hormones. Men have a certain constance when it comes to their hormones. In women, there's fluctuations by the day, by the week, by the month, by the year, and by the decade. And sometimes there is a lot of indication as what's going to happen to you in future. So I always believe that there are times in a woman's life when hormones change dramatically. Premenstrually, big drop in hormones before the period start, which is why some women will have PMS. And again, this is something my patients taught me, which I didn't get from a medical book, that as you get into your 30s and early 40s, your PMS may seem to get more intense. They tell me that we now have symptoms not just for those 2 or 3 days, but going to a week to 10 days and even more. The second is delivery, post-delivery. When you've delivered, you have a dramatic fall in your hormones. The baby's out, the placenta is out. Postpartum depression, postpartum blues. And then something in the West, we don't have it, but the seasonal active disorder. And then for us, the perimenopause. So here are these important changes. And firstly, you have to understand them, and now you've got to prepare for them. When you are preparing for this next stage in your life, I believe that you have to, it's got to be a planned process. You mentioned exercise. There is no one exercise for everyone, but there are certain things that all human beings and women should be doing. So if I had someone who is perimenopausal or even before, but particularly if she's perimenopausal, I would say, do it in your way, on your time, but there would have to be some kind of aerobic exercise, because you're going to very soon start struggling with your weight because of what your hormones are going to do. There has to be some degree of flexibility. So you take your pick, whether it's yoga or Pilates. I am a big believer in what is there for us, yoga. It's so great. I mean, it's we who gave it to the world. Why aren't we using it more? There has to be some strength training, because you build bone till the age of 40 and then spend the rest of your life losing it. So put on as much as possible into your bones, so you're better off with your osteopenia and osteoporosis. And finally, something which is completely neglected, the pelvic floor. The pelvic floor is something that we human beings have struggled with, because we are the only animals which are bipeds. So here is gravity pulling all your internal organs down. Here is this massive muscle which is hidden from everything else. Here is the difference between women and men, where the space that the vagina creates is a space that can completely create a problem for, and then there's childbirth. So if you don't attend to your pelvic floor, you're going to start having your urinary symptoms and your prolapse and vaginal symptoms later on. So if you did this, you would probably start off well. Diet and nutrition is different for different people. I mean, it is your culture, what you eat. But there are certain simple principles that you can follow. And here, I must say, I put aside my ego and I make sure that there's someone who knows this, who can do it scientifically and holistically. Because if you give a written out diet and you give the same thing to every woman, not going to work. I always tell a patient of mine, when you're working with your nutritionist and a dietitian, remember, it's your diet. Don't force yourself to have things you hate, because you'll never follow it. So here you negotiate with them and do something which works for you, but with their knowledge and science. I think that's extremely important. Other things in lifestyle, I believe, is that we do live in a very messed up world. And you did mention the estrogen dominance. And some of this estrogen dominance comes from the fact that we are today starting off life. We are seeing obesity like never before. You see a class of girls in a school today and go back 30 years, big change in BMI. So we live in a world of plenty. And particularly in our country, we have at least, where we are kind of developing very quickly, are very, very large growing population in the urban areas and even the well-to-do in the rural areas, we are adopting a lot of bad habits from the West. So we are constantly maybe 15 or 20 years behind them, but we catch up very quickly, which is why the age of first period is changing. A lot of things are happening. So that's a big starting point because, the fatty tissue can kind of even disrupt your hormonal system. But then the world we live in, this thing about, we write about endocrine disruptors. It's all out there. It's there in the environment. We aren't even really aware it's there. We kind of just live our lives thinking, oh my God, this is what we have to do. But the byproducts of industry, particularly the plastic industry, act like estrogens. And I can tell you that from my experience. I'll give you two important illustrations. Male infertility. When I was a student 30 years ago, the WHO said that the cutoff for a normal sperm count was 60 million sperms per ml. Today, they've brought it down to 20 million sperms per ml.
Wow.
Because in 30 years, a majority
That's
of men would fail the 60 million test.
Wow.
And this is across species, not only in human beings. There are certain defects in women that we saw. There was, at one point, there was a drug called diethylstilbestrol, 1970s. We've made a lot of mistakes and we've stumbled a lot in medicine. And this was a drug, it was an estrogen given to women to salvage a pregnancy under threat. And then we saw side effects and complications. So we banned the drug. Today, I still see those side effects. Now, why are those still happening when no woman is taking that drug? Because it's there in your environment. We know today that endocrine disruptors are there in your kitchen, they are there in your cosmetics, they are there in your life, and you have a responsibility to understand them. I'm not against any particular industry, but maybe we could just minimize our use of plastics in our life. Maybe we minimize the use of the non-stick cookware in our lives. Maybe we kind of read about healthy habits when it came to protecting your families. Get those plastic bottles out of your refrigerator and put back the glass. And I think these are responsibilities that we have and people can have when it comes to moving to the next phase well. The next thing I would say is, when you are prepared with what to anticipate, you are going to have menstrual disturbances. And it's okay not to have a period every month. It's okay to have a period early by a week or 10 days. But if it's disruptive and more than that, we can do something about it. The symptoms of menopause flushes, a lot of women just cope with them by dressing smart, by controlling the environment, by increasing their fluid intake. But if you need medical care, by all means, what you can do with your diet to make things better. There's a lot of good stuff you can eat which can modulate your hormones, or hormone therapy, which is absolutely indicated when a woman is suffering. She doesn't have to go through the next 2 years miserable. The dryness, the hypoestrogenism, the low levels of estrogen, recognize it. Don't be afraid of it. Deal with it. That's where, again, nutrition comes in. That's where the help of hair care and skin care comes in. And then, of course, again, you've got medication. So she has to prepare herself physically, mentally, emotionally. She has to. And finally, I would also say, and she has to be willing to demand help. I won't just say ask for help, demand help and support. And I'm not just saying this from the people, the professionals in our life. I'm also saying this has to come from a partner and from a family. And why do women try to protect, or they think they are protecting the people around them from what's happening to them, when they are so upfront when things happen to anyone else in their family? Child has a cough, husband has a slight chest pain, and you're rushing to the doctor. She has a symptom, and she will kind of override the signals to her brain and say, no, I'll wait, maybe it'll pass off. When she starts struggling with menopause, I say, sit your family down, have a conversation. Trust me, they will want to help you. But if they don't understand what mommy is going through or what your partner is going through, how are they going to be more sensitive and of assistance?
Oh, that's beautiful, doctor. I want you to talk about sleep and stress as well, because we see a lot of these women who come to us, and we're trying to, coach culture, lifestyle changes into them. And they'll have a great month. And in the next month, all the symptoms will come up, the flushes, some of them on medication. It's beautiful. They're changing their nutrition. And the one thing that they missed that month was sleep, some family issue, whatever it is. And we all know the impact of sleep deprivation, increase in estrogen, drop in progesterone. Are you seeing that a lot today? Because I'm seeing that affect even young teenage girls, bringing on PCOS and PCOD. And all of them are not eating junk. Of course, some are. But some are having home-cooked meals, but they're to 2 in the morning, 3 in the morning, 6 hours of sleep for a teenager. We're seeing the impact on hormones. What's your take on that? And even the change in lifestyle. Like you said, there's so much more stress. Today, women, men want to do so much more. They're aspiring for more. And while they can do it because they have willpower, knowledge, qualifications, but biologically, after a point, if we're working hard, I believe we should rest hard. I mean, be the CEO of a company, but if you're burning yourself out, you're going to have problems. So the more work you have to create, these pockets of relaxation. A woman, of course, become a CEO, become huge, but it's your responsibility to also not burn out and create that balance. More work, more rest. Less work, then you can balance it out. But we're seeing that impact. We're seeing that impact of early menopause hitting women in 39 and 40 because of stress. Because the doctor said everything's fine, as your vitals are fine, everything's good, your hormones are fine, but your lifestyle is bringing it on early. Are you seeing these kind of cases as well?
Yeah. So firstly, the stress and the sleep, and the second thing is the early menopause. So there is no doubt that we live in a society which is a very driven society. Partly society drives you, but more importantly, it's individuals driving themselves. Not everyone, but there's definitely this large group of individuals who want to do so much more and who feel that there isn't enough time. So what gets sacrificed is sleep. I don't think there's a magic number for sleep. I think people have to work out what works best for them. But you're so right in saying that you have to allow that repair to happen. You have to allow downtime for you to be top of your game the next day. There are lots of ways and lots of means to kind of bring that about, and there is a direct link between the impact of stress and sleep on where she is hormonally, emotionally, and physically. You're so right about the weight issue. They're so right about the metabolic syndrome issue, which has a clear linkage with sleep. And obviously, with lack of sleep, there's so many other things that come in. So this is something that people are doing to themselves. When it comes to the perimenopause, it's something that hormones are also doing to you. You may want to sleep. You may have all the right signals you give yourself, but your body won't let you. So if you're someone who's gotten to the vasomotor symptoms, the hot flushes and flashes, but the night sweats that happen at night when you're there, and it's almost hilarious when I have this couple sitting before me and she's complaining that she's hot all night and he's complaining that he's freezing because of what she sets the temperature at. And so that's a reality, and that's something that must be addressed. And for me, if there's one dramatic indication for menopause hormone therapy, which is what we call hormone replacement therapy now, it's these kind of disturbances, which are magically taken care of with medication and safe medication. Hormones scare people, but hormones shouldn't scare people when they are indicated. So I think this is extremely important. We are seeing earlier menopause. We don't like to call it, menopause has connotations. So we first said premature ovarian failure, but then in modern society, we don't like the term failure. I always say it comes from the HR people. So now we call it premature ovarian insufficiency. Before the age of 20, it happens to 1 in 10,000 women, 20 to 30, about 1 in 1,000. But before the age of 40, it happens to almost 1 in 100. So if your period stopped before the age of 40, you have premature ovarian insufficiency. We haven't really understood why, but we do know that it's basically depletion of your oocytes or your eggs early. It's not always in your control, but it's something that needs to be addressed. I think this is one place where lifestyle, diet would be more important. But more than that, this is one place where hormone therapy is mandated. Mandated. Because if you're going to start the changes that women would have normally had in their mid 40s, 10 or 15 years earlier, just imagine where it's going to land you up when you're in your 60s and 70s. And interestingly, if you go by any consensus, medical consensus, no matter where she starts her premature ovarian insufficiency, she will be on hormone therapy till the age of natural menopause, which would be 45 or 50. It doesn't matter whether it's 15 years or 20 years or 25 years. I have some girls who are in their 20s who will be on this treatment, and I will tell them, you're never going to get off it because you need estrogen in your system to keep you safe in the long term. Interestingly, when we use hormones in the younger woman, they are far safer than hormones in the midlife, which are also extremely safe when used judiciously. So I'm so glad that we just touched upon it, because there'll be lots of the people watching the podcast today who would have maybe themselves or someone in their lives who are so petrified of the fact that menopause can happen early. And if it does happen early, this is a medical issue which needs to be cared for by a doctor, and which can carry you and make you as normal as anyone else.
Now, I'd love to emphasize on that point, because a lot of people are scared of hormonal treatment. But imagine a young woman growing up with less estrogen. Your bigger issue is going to be osteoporosis, osteopenia, cognitive brain decline. Today, we're seeing the effect of low estrogen, not midlife, I'm talking 30s, with Parkinson's, Alzheimer's, cognitive dementia. So I think it's very important that we shouldn't be scared. I know certain cultures have put that fear that it's aggressive, it'll cause ovarian cancers. But I love what you use, the word judiciously. Even in midlife, excess estrogen doesn't have to cause a problem unless it's excess. And with the xenoestrogens like you spoke about, I want to go back to that point that women have to be aware of the cosmetics, men as well. Every fragrance you have today has xenoestrogens. Your toilet air fresheners, the one that gives that powerful smell, estrogen everywhere. These are little changes we can make, like you said about plastic. I mean, we're living in that world, but how we minimize it is less burden on your body. But I think even the kind of clothes that women and men are wearing today, all of these dry fits, these tight pants, it's all with, estrogen disruptors in it. And we got to go back to cotton. Originally, Indian men and women for yoga used cotton. And today we're using all these brands which are being proven in the Western culture, but yet we take it because it's a brand that makes us look good, gives us the curves and all of that stuff. Even the underwear that people wear today is so synthetic, and they contain estrogen disruptors for men and for women. But these are little changes we can make. It's not impossible. I love that you spoke about that, doctor. And I want to pull out one more point, which you spoke about, which is very close to my heart. You didn't just speak about aerobic training and flexibility. You spoke about muscle. A lot of people don't understand that muscle is an endocrine organ, and it regulates hormones in men and women. And we've seen women, even in their menopausal phase, who now start to lift. Forget about weights. They're using their own body weight. And their side effects, hot flashes, it's getting better. They're feeling better. They're building muscle mass, which they are otherwise losing, which in turn puts on more fat. I mean, it's making me wonder whether you're trained in holistic medicine as well, because the way you're talking it's absolutely fantastic. Doctor, you spoke about all these lifestyles. I also want to talk about, we were having a conversation earlier. See, I'm not against C-sections. It's needed. It can save lives, the baby, all of that. But today it's become kind of normalized. And I think every woman and man should also know about the benefits of having a natural birth versus a C-section. Like and I'm happy to say it on camera, when my wife was going, we planned everything for a normal delivery till the end, where genuinely she needed a C-section. You do a C-section. But the point is, we're missing the information of the intelligence of a vaginal birth. Right from the health of the mother post to the health of the baby. In no way do we say that C-section babies are going to be worse off, but there's always a better choice, which is the way nature has done it. What's your take? What do you see happening today?
So before I get on with that, you mentioned hormones. And so something I always bring out when I speak to women and to other doctors, This is a very interesting kind of an observation made many years ago. It's about the birth control pill. Sir Malcolm Potts, who was a great kind of proponent of contraception, said the pill is extremely safe. Some women are dangerous. And the same goes for hormone therapy. It's extremely important for us to find who would not do well and give them their alternatives and use hormones for very clear medical indications. The mistake the West made, and we had a terrible backlash to that, was using medical hormone therapy, menopausal hormone therapy, as a kind of solution for everything. Everyone got it. Oh, it was the fountain of youth. That's ridiculous, because the moment you do that, there's always going to be a backlash. So there's no question. It's wonderful when it's indicated. It has to be done in the best possible dose by the best possible route. Today, transdermal is superior to oral because it bypasses the liver for the most reasonable time. And that doesn't mean she's going to suffer after that. It's not like you've withdrawn her hormones, because by that time, her body has moved on to the next phase, and then she can manage it with so many other things. And I mean, here we can just probably maybe have a conversation, which you can tell people about, is what about all the great stuff that they can do in their diet? What we call as phytoestrogens, which are so safe and which give you the benefits of estrogens without having to. So the hormones that we use are what the body normally has, but at the end of it, it's still something we're putting in. What about all the stuff that you can do with your soya and your tofu and your flaxseed, which put into your diet? And who knows, so many of your symptoms might just get modulated with that. A childbirth is probably the most important process in human life and existence. I mean, just imagine that the journey into the world, we always say that short journey through the pelvis is probably the most dangerous journey a human being will ever take. And it's still the way it's been done for millennia, forever. I'm so glad you said vaginal birth, because we are now kind of getting away from normal, abnormal. So there's the vaginal birth and the abdominal birth, but the vaginal birth was how it was meant to be. And unfortunately, we are sometimes now getting this, we were led to believe that, oh, but women want more cesareans. Trust me, it's not true. Women want what's best for them and what's best for the babies. And if you can allay certain fears, I think there's no question that a vaginal birth probably scores over an abdominal birth every time, every day. Why? Because she gets back to her normal life so much sooner. I'm not saying with C-sections they don't, but so much sooner. The C-section is a major abdominal surgery. Interestingly, today, it's become the most common surgery in the world. Most C-sections are performed in the world than any other surgery human beings go through naturally, because it's like a certain percentage of childbirth. But we have had, for many different reasons, C-section rates going up in almost every part of the world. There are some parts which are doing too few. There's some places in Africa and even in our country where I feel they're doing too few cesareans because you need a certain optimum number for safety. But doing too many cesareans is also not a good idea, because you're putting a woman through an unnecessary anesthesia, unnecessary major abdominal surgery with its risks. And what people don't understand is today we are seeing a very serious problem and complication in future, where the placenta gets adherent, something we didn't really see 20 or 30 years ago because of too many C-sections being done. Now, when I was to look at the benefits of normal childbirth, firstly, once it's done, it's done. My patient gets up, she goes to the room, she sits up, she has a meal, she's up and about, she's able to do stuff for herself, for a baby. There are lots of other benefits which people have reported of going through the vaginal biome for the baby. In fact, there are also some studies which show that you have to seed a C-section baby to make it better, but those have never really panned out in practice. So you have to prepare for it. And I think a woman, like you said, in your case, both of you prepared for a vaginal birth. So if you're constantly asking and talking to your doctor, if you're preparing for it with knowledge and information, today I think just as we are speaking about how we look after the women we take care of, there's also a different specialist, a childbirth educator who's trained to prepare you for childbirth. Every patient I look after has a few things she has to do. She has to do her diet right, compulsory, no unnecessary supplements, only supplement what she needs. Interestingly, every patient of mine has to go to a dentist and get her dental health taken care of while she's pregnant. But every patient of mine has to do her physical workout and exercise, including her squats and her duck walks and her perineal massage in the last 1 or 2 months, so that she has her best chance of having a vaginal birth. Interestingly, there's something called as an episiotomy, which is an incision that's made on the vagina to let the baby out, which we in India have been conditioned and taught to do, and the West doesn't. And I actually taught myself that it's not necessary. And if a woman is preparing herself right, she can even deliver normally and naturally without requiring the episiotomy. So once she is ready and prepared, the one thing that scares women is the pain. And they always ask me how painful it is. And I say the one time in medicine that we are actually truthful is we use plain English when we say labor pains. We don't have any fancy Greek and Latin terminology. But today with technology and with what we call as labor analgesia, I can pretty much make your labor as less painful as possible if you want it. And if you don't want it, don't do it and go through it. So I personally feel that vaginal birth is something we must offer. We must respect if that's what she wants. So I must say, on the flip side, if I am someone who believes in a woman's right to choose, at the end of it, if she was to turn around and say, listen, doc, I understand what you're saying, but I'd like to have that C-section. The profession does breast augmentations and breast reductions without question. I think after you've counseled her adequately, she has a right to make that decision as well. Now, certain misconceptions have come in, and those have been, the increase in C-sections also has other reasons. People are always very wary of institutions and doctors. But remember, we are also today living, in a society where women are having childbirth later. So we have more medical issues. We have more other issues. So more other indications. Secondly, women who would have never conceived in the past are having pregnancies. I have a large number of patients with autoimmune disorders in pregnancy, SLE and the like, who have their medical issues. Thirdly, elderly women. Today, a large percentage of my patients are in their late 30s, many of them in their 40s. Having said that, I believe just because you are in your late 30s or 40s, you cannot be forced to have a C-section, which unfortunately is what's happening today. Oh, you're 40 plus, you have to have a C-section. Absolutely not. I would say a healthy 40-year-old is better than an unhealthy 30-year-old. She has a right to do whatever she wants, a majority of IVF and ART babies. Oh, it's a precious pregnancy. I think that's offensive, because what do you mean the other pregnancies aren't precious? Just because she had a difficulty conceiving does not mean she can't have a normal childbirth, a vaginal birth. She has every right to do so, and most of them will. So now it's time for women to start having an informed conversation with their doctors and ask for more support when it comes to doing things the way they want. And I believe, given a choice, a majority of women would opt for a vaginal birth.
That's amazing, doctor. And I just want to make sure, like you fairly said, this is not to put pressure on any woman out there, but I believe every human has a right to knowledge.
Yes.
And the way it's being pushed today that, oh, you won't have pain, it'll be in and out and all of that. I mean, it can be that, but you have a right to knowledge to know what is best for you. And then you decide what you want to do and make an informed decision with your doctor. Doctor, in between this amazing conversation, I know you have a C-section in the next 45 minutes.
Okay.
So I'm going to ask you another question and then invite you back to our show to discuss a few more things which we've probably not had the time to do it. but I want to be respectful of your time. Speaking about IVF, I believe in IVF can give that gift of a child to a family that's been wanting it. But I also do believe that IVF has been pushed down people's throats the wrong way, without the right information, without precautionary warnings, without assessing a person that, hey, okay, fine, you want a child. You have 6 months, great. Why don't you try this before we push IVF onto you? There's the right way of doing it, there's the wrong way of doing it. I would love for your views and your thoughts on, IVF. I feel a lot of young patients are being pushed into it where they have the ability to conceive, but they've just been pushed with fear. And then they suffer from the side effects of so many things that come with a treatment like that, and they don't even know about it. So I would love for you to talk about this.
So IVF is great technology. It's probably one of the greatest advances in gynecology in the last 100 years. And recently they reported that about 1 million IVF babies have been born in the world. So there's no doubt that IVF today gives hope to couples who didn't have that in the past. But what bothers me about IVF is 2 or 3 different things. Patient selection, where you're absolutely right. I do feel that sometimes couples who haven't gone through a reasonable process, been given reasonable time counseling and basic therapies, do land up with IVF. But that's the nature of I wouldn't say profession. Unfortunately, when things get a little, the system changes. When there's a number of people providing a certain procedure, it tends to be utilized a lot more. IVF has its own issues. IVF has its own risks and complications. We are much better than we were in the past. In the past, there was a very high risk of what we call as ovarian hyperstimulation. We are still seeing that sometime, but much less than it used to be. We're seeing a very, very high level of multiple pregnancies, and people are quite thrilled when they hear about twins. But trust me, every multiple pregnancy carries additional risk, and that's something you have to accept when you do go for an IVF. IVF does use very large doses of medication, generally with no long-term implication, but in the short term, it can be extremely disruptive for a woman's body. So here is this amazing technology. I think there has to be a blueprint for getting there.
Beautiful.
For me, it's simple. I normally, if I have a couple coming in, depending upon where they are, obviously your approach might be different when she's 30 than when she's 35, when she's 40, because fertility drops dramatically. But please understand, I still have a number of my over 40s who do conceive on their own. If they have their fertility, a lot of it is what they inherit from their mothers. So if a mother has had a late menopause, she'll probably have a late menopause, and she's perfectly capable of having a baby without assistance, which we intend to jump in for. So the first is just, one of the most basic issues we need to set right is this fact that even today, when couples are trying for a pregnancy, they are doing it with complete, almost ignorance. A woman is fertile on that one day after she ovulates and maybe the 2 days before. And most of the time, if you can help a couple who in their busy modern lives sometimes don't have time for the most important things in life, just find the right time, they'll conceive.
Yeah, true.
So just give them time, patience, hand-holding, direction, they'll conceive. Simple technologies exist where we've got medications to induce ovulation, which now we use very judiciously. In the past, they were used for months and years at an end, and then there was a slight increase in risk of ovarian cancer, which we are very, very cautious about now. She'll conceive. Simple procedures. There's a procedure called an intrauterine insemination, a very simple, basic procedure for what we call as unexplained infertility. She will conceive, and then if she still hasn't, it's also important that she goes to IVF at the right time. There are two extremes with IVF. They're either going too soon or they're waiting for too long.
Too late, yeah.
That's wrong. So you have to have this clarity and a blueprint for yourself, or sit down with your doctor and say, where do I go from here? And sometimes today couples come to me who don't even exactly know, and you literally have to help them make their decision. So very simple question I will ask every patient is, when do you want your baby? And they'll turn around, we'll start trying next day. I said, that's not the question I asked you. When do you want your baby? So then they'll come up with a date and a year. I see, I won't hold you to it. And then you count backwards. And you count backwards 9 months to make baby. And it takes 6 months for 50% of even normal couples to conceive. So don't start panicking. Give yourself time. If you haven't conceived in the second month, don't go rushing for intervention. And this is where you can. So this is extremely important. IVF has to be done when it is indicated. And obviously, again, I must say this here, IVF clinics have mushroomed. And you have to find the right person to work with, because you want to make sure that there's going to be quality and there's going to be results, because these aren't really put out. So you got to do your homework before you go to someone. There's one other thing I'd like to touch upon when I talk about an IVF, and that is today women may not be finding a partner till much, much later in their lives. And when they get into the earlier 30s, they should at least consider or be guided to consider the possibility of freezing their eggs. She may or may not do it. That's her choice. But if someone didn't tell her about it, or she didn't think about it, and suddenly she finds she's 38 or 39 and she's now going to struggle, it's maybe a little too late. So when she's around the age of 32, this is basically an IVF process. You may never need those eggs, but the eggs are a great plan B or a backup plan. And it's something 50% of women will tell me, listen, doc, when time comes, if it doesn't happen, I'm fine. I will either adopt or I'll go for a donor egg. But at least she's made that decision. The doctor hasn't. But then another woman will say, for me, genetics is important. And I would like to do my bit. And once that egg is frozen, she can have the baby when she's 35, 38, 40, 42. She might do the first one on her own. She might use the frozen eggs for the second one. That's her choice.
Correct. I love that you leave this honest choice to your patients. I want you to give hope about AMH as well, because we see too many people, they come, oh no, I have to do IVF, I have low AMH, and we're seeing people with 0.20s in the right period of time conceive naturally and beautifully. And then there are people who genuinely need the treatment.
That's right. So basically at the end of the day, one thing modern medicine has relied too much upon is reports. You don't treat reports, you treat the person. AMH is a test that came in about 15 years or 18 years ago. It's a great test. It's the anti-müllerian hormone, which is supposed to reflect ovarian results. Now, your ovary, you start life. A woman starts her life with about 2 million oocytes. In her intrauterine life, she's got 5 million. At birth, she's got 2 million. And basically, by the time she reaches puberty, she's like got 200, 300,000. And these she has to use judiciously for the rest of her life. So nature gifted her and said, here are your eggs, live with them, use them wisely. This is what you have. Interestingly, the body is completely over time by replacing every cell. One of the only cells that doesn't change is the eggs in the ovary. They are as old as the woman is. So a 40-year-old woman has 40-year-old eggs, which is why, again, fertility does go down. Now, AMH basically tells you where you are with your ovarian reserve. It's a great test, and I use it a lot, basically to have a discussion. I don't use it to define. If she is menstruating well and regularly, even if she has a low AMH, it means she is ovulating. And if she is ovulating, she can conceive. I have a problem with people telling women that if your AMH is low, the quality of your eggs is poor. It's not about quality. Your eggs are still 37 years old, okay? So yes, a 37-year-old egg will perform less effectively than a 27-year-old. That's a no-brainer. She chose to be here. But to tell her that because you have a low AMH, you've got bad eggs is absolutely unscientific. Now, with a low AMH, what happens is that, okay, you are on the clock. but you can still conceive naturally. You're so right. I too have had patients with a 0.2 and 0.3 conceiving, but she does not have the luxury of saying, go back and come after 6 months or come after a year. What I would also do for a patient like this is I would use simple tests. In the West, they use the ovulation kits a lot. In our country, we have easy access to ultrasound. I'll just track ovulation, time her perfectly, and many of them will conceive. It's amazing how many with low AMH conceive. So a low AMH is not a reason to rush in for an IVF. A low AMH is not a justification for taking a donor egg. But a low AMH tells you get on with it, get monitored. Depending upon the level and depending upon your age, you set your time limits. And yes, if finally it doesn't work out, IVF is an option. Yeah. And if finally it doesn't work out, and today, remember, today a menopausal woman also has the option of being a mother. That girl we spoke about having premature ovarian insufficiency, whose mother is panicking, is told by me, your daughter's going to be on hormones. She's going to maintain all her secondary sex characters of breast. She's going to protect her heart and her bone. And as and when she wants to be pregnant, she will have a pregnancy, because this is one of the wonders of modern medicine. IVF, donor egg, a woman who is technically menopausal can still be a mother. Of course, we now have, our government has set a limit of 50 years, but I'm telling you, we've had patients even above that, and there are some ridiculous reports from other parts of the world of women being much older and having a pregnancy. So AMH has to be seen in its own context. It's very often also used along with something called as an antral follicle count, where on the second, third, or fourth day of the period, an ultrasound also checks how many potential follicles there are, and a combination of these are a very useful guide. For me, it's like the fuel gauge of a car. When your AMH is low, the needle has come into reserve. Your car will not stop. It will not perform less efficiently. You will still have the same acceleration. But since you'll be running out of fuel soon, you would have to get to a gas station. With the ovaries, we can't go to a gas station. So at some point in time, you are probably going to have to finish what you want to do early. Okay. 2 or 3 other things coming up here with this particular problem. As of now, not mainstream, but there's a lot of new technologies where people are trying to rejuvenate ovaries. I think probably like to squeeze out those last few oocytes. So there are ovarian injections with PRP. People are using a lot of other stuff. And there is, of course, the surgery of an ovarian transplant, which I don't think is really justified, because if I'm going to take this complicated surgery, I just might as well give her someone else's eggs. And then there is oocyte donation, and oocyte donation can make a pregnancy a reality for a woman who doesn't have eggs of her own. So even that is not something that completely is a dead end for her.
Wow. Doctor, I know you need to go into surgery right now, but on our next episode, what we do want to discuss is contraception. If a woman needs to take a birth control pill very frequently, we're going to talk about that. We're going to talk about abortion as well. And we are also going to talk about a male's role in a woman's health when it comes to, because too many women are out of pressure over there where they feel, and I know these women come and say, Luke, our sex life is going to change if we go into perimenopause, menopause, and it's a huge myth. Sometimes the guy just has to learn how to do things differently to contribute and take that pressure off a woman. So that's going to be on our next episode. We were going to do it today, but I think Doctor has a surgery, and we have the privilege of having him back on our show again. Doctor, this has been just amazing. Thank you so much.
Such a privilege, Luke. Thank you for all you do.
Good luck with your surgery coming up, and see you soon again for our show. Thank you so much.